A cervical smear test is a test to try and detect abnormal cells in your cervix. It's not to diagnose cancer, but it's to detect abnormal cells that could progress into cancer. Symptoms of cervical cancer can include vaginal bleeding, painful intercourse, changes to your vaginal discharge, pain in your lower abdomen, lower back. But also, these symptoms can also mimic other conditions like fibroids and endometriosis. So it's always good to have them checked out and to get a diagnosis of what it actually is, because it may not be cancer. You need to be invited to have a cervical smear by means of a letter when you're 25 years old. You could get a letter about 6 months before your 25th birthday, and then you can book an appointment, but it needs to be by invitation only. You will then have a smear test every 3 years until you are 49, and then every 5 years from age 50 to 64, and each time you will get a letter. If you've had a hysterectomy or anything like that, then you would be taken off the register, and anyone 65 or older, you only have to be invited for a smear test if one of your last 3 tests was abnormal. Cervical screening is normally done by your practitioners at your GP surgery. So when you've had an appointment letter booking at the GP surgery, or otherwise it's like a family planning clinic, you'll be asked to lie on a couch with your legs bent and your feet apart, and a speculum is inserted into the vagina and then opened slightly to view your cervix, and then a brush is used to take some of the cells from there, and then they're sent off for sampling. You should get your results in about 3 weeks after the smear test. It can be a little bit uncomfortable, but your nurse should reassure you and make sure that it's a positive experience so that you do return and have future smears. After your smear test, it's best not to have intercourse for 2 to 3 days, as the pressure from intercourse can sometimes make you bleed a little bit, so it's just best to abstain from sex for a few days. No, it's best to have your smear test mid-cycle, so 14 days after your period. Otherwise they can't get the right cells and the test wouldn't be done properly. When you receive your results, if you do get an abnormal smear, you will be invited for a colposcopy just to have a look at those cells in further detail, just to ensure there's nothing untoward. And the majority of the cases, everything is normal. And when you sometimes have abnormal cells, they just sometimes correct themselves and don't develop into anything. But it's always good to have them checked out.